All right. All right. So what we're going to do today is we're going to go over the slideshow, just basic part of the course. This takes away some of the time that we have to do in person as far as at the pool. So we're going to kind of go through the American Red Cross blended learning course presentation. Professional lifeguard and setting the stage for safety. Make sure when you become a lifeguard, you know your facility policies and procedures. You'll probably learn that from the pool manager. Locations of important areas, locations of emergency exits, AED, and first aid kits. Hopefully, most of your pools, if not all of them at this point, have AEDs accessible for you. Measures taken to ensure your safety during the session. The course purpose is to help prevent and respond to emergencies in both shallow water, which is less than 7 feet, and deeper water, 7 feet or more, including land and water rescue skills, as well as first aid and resuscitation skills. The core competencies, you will demonstrate knowledge and skill competency in 4 main areas: foundational lifeguarding concepts, water rescue and extrication, meaning to pull them out, resuscitation, including ventilation, CPR, AED, as well as first aid, and then individual and team rescue and response. To successfully complete the course and receive certification, you will have to attend the entire class and participate in all class sessions, actively participate in all course activities, demonstrate proficiency in all skills, pass the final written exam with a minimum grade of 80%, and that's out of 50 questions, and then pass the final skill assessments, which that's what we'll be doing on Saturday or the 9th. Upon successful completion of the course, you'll receive a certificate for lifeguarding, which includes deep water, as well as CPR, AED for professional rescues and first aid, and that is valid for 2 years. During the course, you must demonstrate professional attitude and mature behavior. Be prepared for all activities, including wearing appropriate swimwear for all in-water activities. Just know that we don't wear goggles for any of the lifeguarding courses in person. You'll need to complete reading assignments, include answering end of chapter review questions, and before each scheduled class. That will be what we're doing on the blended learning on the online portion. You need to behave appropriately during activities, work to improve skills during practices and skill drills, treat others with respect, follow all pool safety rules, take measures to ensure your own safety as well as that of others. We'll go over that on that specific day. Demonstrate respect for the facility and equipment. And then make sure when we're doing the testing, you're going to turn off or silence your cell phone, refrain from using mobile devices during all class sessions, except when you are accessing digital course materials. Secure any items of value or avoid bringing them to class if possible. One of the things I'll try and even send out today, is the course booklet for lifeguarding itself. So that way, if you want to look through it, you can, and you can have that available for you when you're doing the testing that's with the blended learning portion. All right, professionalism on the job. And these are for you guys to answer some questions. How can a lifeguard demonstrate professionalism through their appearance and behavior? Anybody? Anybody have any ideas? Especially those of you that are returning lifeguards?
Not look lazy on the stand, sitting up attentively.
Always sit up attentively. Absolutely. Make sure you're wearing the lifeguard uniform properly, including a whistle, a hip pack or fanny pack, and a rescue tube. Make sure you're standing or sitting with good posture. Make sure by staying alert and focused on their activities in the zone and your zone at all times, and by maintaining a positive safety first attitude. What are some of the behaviors that demonstrate a lack of professionalism? One of the things that I see lifeguards doing all the time, and I was definitely guilty, just twirling your whistle, putting your legs up on the stand instead of actually sitting with both feet on the stand itself. You just kind of put your legs up over the bar. Those are all things that will do it. Using mobile phones or other personal smart devices while on surveillance. Your phone should never be with you on the stand or while you are guarding. Eating or chewing gum while on surveillance duty. Engaging in conversation with patrons or coworkers while on surveillance duty, which is probably one of the hardest ones, especially For those of you that are at country club pools, those kids tend to feel like you're more their friend anyway, so they're going to want to talk to you at all times. Slouching, twirling or playing with a whistle, like I said earlier, not wearing the lifeguard uniform properly, and not wearing or holding rescue equipment properly. The rescue tube should be over draped across your shoulder and then seated across your lap when you are on the stand. You don't just have it hanging on the bottom of it. You don't have it hanging behind you. What it means to be equipped and rescue ready. Make sure you're wearing or carrying the appropriate rescue equipment for your facility and that you are ready to enter the water to perform a rescue. When you are going out to the stand, you should most likely have a rescue tube with you, as well as your fanny pack. Your hip pack, fanny pack should have your mask. It should have gloves. It should have some kind of Band-Aid as well. And each person should have their own because you don't want to be sharing masks, obviously. Or at least each guard that's there that day should have a fanny pack so you're not trading that off as you switch stands. So you always wear a rescue tube when on surveillance duty, a hip pack, fanny pack, and a whistle. Other things that are also important to have would be sunglasses and a hat, especially on sunny days. You want to try and keep glares out of your eyes. Lesson 2, surveillance and preventative lifeguarding. The lifeguard's role in preventing drowning incidents. Anyone, even a strong and experienced swimmer, can become a distress swimmer or drown at any times. Lifeguards have a lot of responsibility and they need to take the job seriously. Lifeguards need to be trained, prepared, and ready to respond in an emergency. And the lifeguards who are on duty, that's going to be a video that you're going to get to watch at some point. When Drennan drowned, have to live with what happened that day for the rest of their lives. I hope this doesn't happen to you, right? And we've got a couple of videos that we'll go through. I'm not sure if the first one's on here or not, but I've got one at the end that kind of gives you the idea of what you can or may happen to see. So that's why it's always important. What can you do while you're on surveillance duty to help prevent deaths from drowning at your facility? Stay focused on scanning and avoid distractions. That's probably the most important one. Your head should constantly be moving. You should be looking at the top, the middle, the bottom of the pool. Make sure you're always paying attention to where your zone is, but also keep in mind there's also kind of overlapping zones as well. Make sure you're using proper scanning technique, continuously scanning your zone. Respond with urgency. So if you're going to go in, it's a go in and you need to get to them as quick as possible. Always be prepared, wearing the full uniform and carrying the appropriate equipment. Really, the full uniform basically means wearing a swimsuit, right? You don't want to be up there in shorts or a skirt or whatever. You want to be up there ready to go at a moment's notice. What can you do while you are off duty to help prevent deaths from drowning at your facility? Some of those things include develop and maintain a strong long-term memory of what the behaviors of a distress swimmer and people who are drowning look like. Attend in-service training sessions as well. But even when you're off the stand too, make sure as you're switching out, you're letting the next guard coming on, letting them know if there's anybody that may be having some issues or maybe a little bit of a weak swimmer and they're in an area where maybe you don't feel comfortable. Make sure you're always sharing your thoughts and concerns with the lifeguard that is taking out for your spot. Make sure you know and practice the facility's EAPs, which are emergency action plans. Know where to locate and how to use all of the facility's rescue equipment. For example, backboards, AEDs, bag valve masks. I don't even know how many pools actually have bag valve masks, but if you have it, make sure you know where they are. Make sure you stay healthy and well rested, including that would include staying hydrated, especially during the heat of summer. Make sure you're constantly drinking. Surveillance. How do you fulfill your primary responsibility as a lifeguard? You want to make sure you're conducting surveillance. What does effective surveillance rely upon? It relies upon the lifeguard being able to recognize a person who needs help in the water. So that's recognition. The lifeguard knowing how to conduct surveillance. So using proper scanning technique. Zones and lifeguard station placement that support the lifeguard's ability to recognize, reach, and rescue a person in need of help. And then rotation schedules that provide lifeguards with regular breaks to prevent vigilance decrement. In other words, to make sure that they don't start losing focus. Recognition. What are the characteristics of a distressed swimmer? A distressed swimmer will be able to keep their face out of water. They will be able to wave or call for help, but then they're going to be horizontal, vertical, or a diagonal body position, depending on their means of support. And then they're floating, sculling, or treading water. Right. So those are people that are going to be just a distressed swimmer. I'm sorry. Why can't an active drowning person call or wave for help? Wait, went too fast there. Okay. Why can't an active drowning person call or wave for help? An active drowning person cannot call or wave for help because all of their efforts are being focused on getting a breath. So you're going to see them constantly trying to get their head, their mouth, their nose, something above water. How might a toddler who is actively drowning appear to a lifeguard? They may tip forward into a horizontal face down position and be unable to keep their mouths above the surface. And they may appear to be a doggy doing a doggy paddle, but will make no forward progress. And with toddlers too, a lot of them, you'll see them in water wings or even little tubes. The water wings are better than the tubes. Those kids can go forward or they can even go upside down before you even realize what happened. So the younger ones, especially when you see the parents aren't paying attention, make sure your eyes are constantly on them. How might a passive drowning person appear to a lifeguard? They may look like they're floating or drifting at or near the surface of the water, face up or face down. They may look like they are sinking, like they are resting on the bottom in a face down or face up position or on their side. They may look like a shadow or object, such as a towel or t-shirt on the bottom of the pool. The two, when they're on the bottom of the pool, those are probably the most scary ones because we have kids all the time that like to go down and just do their breath holding contests or see how long they can stay underwater. Sometimes you have kids that do that and that's all they're doing. Make sure you're kind of paying attention to them. But sometimes, especially these days, if you have someone that maybe has a seizure disorder, those can go from bad to worse if you don't recognize it quickly. So do kind of make sure if you see kids hanging out at or near the bottom of the pool, make sure you know what they're doing if they're getting ready to come back up. What are examples of situations, events, or behaviors that can cause a person to lose consciousness and can lead to passive drowning? An active drowning person who is not rescued before they submerge, meaning they weren't recognized first. A person who experiences sudden illness, such as a heart attack, stroke, seizure, heat-related illnesses, or hypothermia in the water. A person who experiences a sudden injury, such as a head, neck, or spinal injury in the water. Or hyperventilation and extended breath holding, using alcohol or drugs in or around the water. The hyperventilation is always a scary one. You see those kids, and probably most of you have done it at some point or another, where you've tried to get short, quick breaths in order to be able to do a no breather, swim the full length underwater. Those are kids that actually don't realize the danger that they're in by doing that. So try to prevent that from happening. Definitely don't encourage it. Um, my wife, who ran a pool, she actually had a lifeguard that his goal was to try to do 100 meters underwater. He didn't tell anybody what he was doing, and he ended up passing away after drowning because he was definitely hyperventilating and working on extended breath holding. And truthfully, the most experienced swimmers are the ones that are more in danger a lot of times because they think they can go farther than they really should. So just beware and definitely don't encourage it. We're gonna see if this video works or not. Okay, here we go. So this is surveillance camera footage of a drowning. Now, maybe a little hard to watch, but we're gonna take some time here. Crazy to note how many people are near this kid and don't even give him a second look. You're always better to make a mistake of going in for somebody than making the mistake the other way. I feel like there must not be a lifeguard. Obviously, this is in Helsinki, it looks like. So it's shocking, though. Crazy. So, anybody want to share how they feel watching that video?
It just makes me sick that so many people went right by that kid.
I mean, multiple parents, and it almost looks as if they're looking right at them, which is amazing to think they didn't recognize anything. But with that being said, that's why it's so important the job that you're doing. You have to always be paying attention and watching. And if you ever think that somebody's having an issue, go get them. Don't don't wait the other way. They keep saying 30 seconds. From the time you recognize an incident, you need to be able to get to that victim, that swimmer, whoever, within 30 seconds. Hopefully, some of you have felt a little bit upset, frustrated, shocked, sad, nervous, scared, angry. Definitely feel all those ways when I see that. What'd you take away from watching the video? Anybody other than Sean? Because Sean's the manager, so he's expecting you all to be doing the job if you're at Forest Hills.
My guards should be speaking up.
I mean, I think something I learned from that video is you can't rely on parents. I think a lot of times if there's like a ton of parents in the pool and there's not a lot of kids, you kind of might think the parents are there, but obviously you can't rely on them.
Brandon, that's a great point, and I'm going to use my sister, unfortunately, an example. She was at the pool with her son, who was 2 at the time, and she was literally sitting right next to him. And she turned away to talk to a friend. And when she looked back, like 3 or 4 seconds later, he was actually underwater, eyes bulging out of his head, about 6 inches underwater, and he couldn't get himself back up. And she literally just took her eyes off him for all 4 seconds. So you can't rely on the parents. Absolutely not. And especially if you're at a country club, they're expecting you to do more than what they're going to do. Drowning can easily be confused with playing. Although there's no recognizable behaviors that indicate a person in the water is in trouble or drowning, not every drowning looks alike. Many people don't know how to recognize that a person is drowning. Drowning doesn't look like it does in the movies. An active drowning person can quickly become passive drowning if the person is not rescued. And if a person does not come up and take a breath for 30 seconds, assume that they need help. The other important thing is if you do go in for somebody that's been underwater, been submerged, or any kind of rescue, always make sure you take them to their parent. Let the parent know what happened and make sure they're aware of the situation. In recent years, there's been something that's been a little bit more well known called dry drowning. and it's kids who've maybe gotten too much water within their lungs. And while they don't look or appear as if they're having issues, what they don't realize is hours later, they're actually still having issues with all the water their lungs have taken on. So it's always important to make sure to let the parents know. Scanning. What is the difference between searching and watching? Searching is deliberate, active, and proactive, requires that your mind is alert. Watching is passive and reactive. What might cause a lifeguard to miss seeing something that is right in front of them? Think about something else. Daydreaming while scanning, unintentional blindness. Definitely also glare. Can you think of a time when you may have experienced unintentional blindness? And I think we probably all have been there. You know, their examples are thinking about something while I was driving and missed an exit. When you were playing a video game, possibly you were so focused on avoiding one threat to your character, you missed another. Maybe if you're watching TV, you realize and had no idea what was going on in the show because you were watching and been thinking about something else. We've all been there, I'm sure. What are some strategies you can use to avoid unintentional blindness while you're conducting surveillance? Minimize distractions such as conversations with patrons or staff. Avoid mental activities that take your attention away from evaluating patron behaviors. For example, do not daydream. Make sure to follow a specific pattern while scanning or mentally rehearse what you would do if needed to make a rescue. Does your ability to stay vigilant start to decline while you are on the stand? Absolutely. The longer you're on the stand, that more that attentiveness starts to wane. What are things you can do to improve your ability to stay vigilant? Maintain an active body position and change position often. Make sure you get enough rest. Stay hydrated. Cool off during breaks. Engage in light exercise during breaks to keep the energy levels up. Get in the water, swimming a little bit, even just walking around, picking up towels, just stuff that keeps you active. All right, so zones within a pool. So visibility drill, lifeguard station response time testing. That could be, you know, you've got someone that's in charge of the diving well, you have someone in charge of the shallow end, you have someone in charge of the deeper end. You each have your own zone of where you would be doing the scanning. A visibility drill is done to verify that objects at the bottom and the surface in all areas of the zone can be clearly seen from the lifeguard station. The lifeguard station response time testing is done to determine whether the size and shape of the zone enables the lifeguard to reach a person in the farthest or deepest part of the zone, conduct a worst case scenario rescue, remove the person from the water, and begin ventilation within 1.5 to 2 minutes. It seems like a long time. And in most instances, they want you to get that person out within 30 seconds. Why is it critical to verify what can and cannot be seen in all areas of the zone? You want to make sure you can recognize that a person is drowning or needs help. The lifeguard has to be able to see and evaluate the behavior and appearance of each patron in their zone. The lifeguard needs to be able to see each patron's head position, body position, arm and leg action, movement through the water, and location in the water. What are some variables that affect what a lifeguard is able to see while scanning the zone? Size and shape of the zone, the type of lifeguard station, the height of the lifeguard station, the patron's distance from the lifeguard station, the depth of water, and then environmental factors such as glare, water movement, and blind spots. When I was managing pools, I didn't care how many people were in the water. I made sure there were always 2 guards on stands at a time. That way there was 2 sets of eyes watching the entire pool, no matter if there's 2, 4, 20, whatever. As we get higher, we would do more guards, but in general, at least 2 for most pools. Why is it important to verify that zone boundaries enable a lifeguard to reach, rescue, remove a person, and begin ventilations with 1.5 to 2 minutes? Evidence suggests that if a drowning person is rescued within the first 1.5 to 2 minutes of submerging, giving ventilations may resuscitate them. That's why you do those 2 initial breaths first when you're beginning CPR, because that actually may pull them back out of whatever issue they were in. Rotations. How should a lifeguard rotation be performed to ensure that there is no lapse in surveillance during the rotation? The incoming lifeguard scans the zone as they are approaching the station. The incoming lifeguard and the outgoing lifeguard take turns assuming responsibility for scanning the zone till the outgoing lifeguard is ready to leave the station and the incoming lifeguard is in position and rescue ready. The outgoing lifeguard scans the zone as they walk away from the station. So all this means this is if you're the lifeguard that's on the stand, the lifeguard that's coming to the stand, they're watching the zone. They're going to stand next to the stand and say, I have the zone. That lifeguard that's on the stand then can turn their back to the pool as they climb down the lifeguard stand, however they need to get down safely. Once they are down safely, they will then take over the zone and they'll let the other lifeguard know, I've got the zone. That lifeguard then will get in position, climb up the guard stand, get seated, rescue tube in place. And then once they are ready to take over the zone, the leaving lifeguard can go to their next stand or wherever they are needed next. All right, we're going to watch a video on surveillance activity and scanning. One of the things you make sure you keep and maintain under control. Severe drowning thing. I'm not sure if anybody has seen yet or not. If anybody sees it, let me know. It's almost nearly impossible to spot if you weren't looking for it either. And that's where it's always important to make sure you're scanning top, bottom, middle. So in surveillance activity, remember the signal detection theory is a cognitive model that describes a lifeguard's ability to detect and differentiate signals such as a distress swimmer or a drowning person from the noise and everything else. According to signal detection theory, when you are scanning, what are the most desirable outcomes? You want to make sure you know what hits and correct rejections are. So you want to make sure you know what are and are not drowning victims. What are two variables that affect your ability to detect a signal? How much the signal stands out from everything around it, and how much you are paying attention. What can you do to increase the likelihood of hits and correct rejections when you are scanning? Make sure you reduce internal and external distractions to the greatest extent possible. Make sure you guys aren't wearing like AirPods or anything on your ears to listen to music. Make sure your ears and your eyes are focused at all times. Keep your mind in the game. Focus your attention on assessing each patron in your zone every 30-second scan. Make sure you know how many people are in your zone the entire time. Come to work well rested, stay hydrated, take frequent breaks from surveillance duties. In my pool, we would basically do a rotation where they would have 40 minutes on stands, 20 minutes on each, and then they would have 40 minutes off a stand. So kind of almost equal to what they were on and off. Make sure you continuously work on increasing your ability to recognize distress swimmers and people who are drowning. I can't stress enough. You got to worry about it all year long, but those first 2 weeks of summer, those are sometimes the most dangerous ones because you have those kids who are good swimmers the year before, but they haven't been in a pool in 9 months and they don't remember what they've forgotten. So make sure you're really vigilant those first 2 weeks. It can set up your entire summer with how strong you are in the very beginning. Is a false alarm a failure? Although it's less desirable than a correct rejection or a hit, false alarm is not a failure. It's never a failure. You're always better off acting than having to react later. Responding to emergencies and rescue skills. Emergency preparedness and response. So as part of your online coursework, you'll have watched a video that reviews emergency preparedness and response at aquatic facilities. An EAP, Emergency Action Plan, each pool will have their own EAP. It's a written document that guides the actions of lifeguards and other staff members in an emergency. What information does an EAP contain? Anybody know what you think would be on an EAP?
The location of your AED and
That would be a
oxygen.
good one. What else?
Maybe like the order in which you want to do the CPR, the AED, how you want to go about like the steps of those to help the person who's
Hey,
drowning, maybe.
that certainly wouldn't hurt. I mean, it would definitely be just a good refresher if needed. You also want the address of your facility so that you can give that to who? Who would need the address of the facility?
emergency
911.
responders.
Yes, EMS 911. If you're calling Sean and he's actually on duty at the firehouse, you need to tell him exactly where you are. Just he's not going to want to hear you're at Forest Hills. Action that should be taken in emergency, and then who's responsible for each action. Those are also things we need to have in there. Why is it important for safety team members to study and practice the facility's EAPs? Study and practice the EAPs eliminates confusion and helps team members respond with confidence during an emergency. In water, in a water emergency, the rescuing lifeguard is responsible for activating the EAP, rescuing the person, providing care as needed, reporting, advising, and releasing the person, addressing contributing factors, and then returning to duty. Surveillance activity injury prevention. We're going to watch this video. Pink chicken is one of my least favorite games I've ever seen. I would tell you never use a football near football. That thing will be hard as a rock. I would also I would also point out this patient right here. She was holding hands with somebody, then released their hand. You got to be careful of that. And this young man right here is like running, jumping a pool a couple different times. So there's a couple other things you just make sure you're always being aware of. I don't think any of us really have to deal with that too often. Yeah. Find anything difficult about the activity as far as watching all that stuff? You know, it was all pretty straightforward. Nothing was too scary there. It was difficult to keep track of what everyone was doing in zones. Especially, it's difficult to know sometimes if you needed to intervene. You may not have recognized some of the situations, behaviors that were pointed out in the video as potentially dangerous. And when there wasn't much happening in the water, got bored. And that's actually probably one of the most biggest, probably one of the biggest things that keep paying attention is when there's not much going on, don't get bored. Always pay attention. Like any skill, scanning requires training and regular practice to maintain. When in doubt, it's best to intervene. Developing a strong long-term memory of dangerous situations and behavior aids recognition and decision making. Long-term memory supports working memory by helping to assign meaning to information, and decision making is faster when long-term memory supports working memory. What are some things you can do to help overcome recognition challenges? You can make sure you know what you're looking for. Make sure you carefully look at and evaluate the behavior of each patron in your zone. That's key for sure. Strengthen your long-term memory of behaviors that indicate that a person needs help by watching videos and taking part in service training with simulations. Lowering the risk for infection, rapid assessment, and ventilation. So this could be more first aid. lowering the risk. What are some standard precautions? Safety measures you should take with every person to protect yourself and others from pathogens that are transmitted in blood, body fluids, or other potentially infectious materials. So make sure you're wearing gloves if you're doing CPR. Make sure you're wearing masks. Why is it important to take standard precautions with every person? Anyone's blood or body fluids might contain pathogens, even if the person appears to be healthy. You don't know really their history. What is the most important thing you can do to protect yourself and others from infections? Cleaning your hands properly and at the right times. For example, after giving care. What personal protective equipment or PPE should you always carry in your hip pack, fanny pack? Disposable gloves and a resuscitation mask. Rapid assessment. When would you perform a rapid assessment? You want to make sure that you're going to use it to ensure your safety and the safety of others in the areas, and then also to identify life-threatening conditions that may need to be addressed right away. So when you survey the scene, that's kind of what you're doing. What are the 5 main parts of a rapid assessment? You need to size up the scene, including checking the scene for safety and also performing an initial impression of the injured or ill person. You're going to check for responsiveness using the shout, tap, shout sequence. You will then open the airway and simultaneously check for breathing and a pulse and life-threatening bleeding. You're going to give 2 ventilations if the person is not breathing as a result of drowning, and then you're going to provide care based on the conditions found. When conducting a rapid assessment, how long should you check for breathing and a pulse? It's going to be 5 to 10 seconds. So no more than 10 seconds. When checking for breathing and a pulse, you notice isolated and infrequent gasps. Is the person breathing? So they're not really going in or out. It's kind of agonal breathing. So isolated or infrequent gasps are called agonal breaths. If you observe agonal breaths, that person is not breathing. So it's more of just like a, just like a brief moment like that. So they're not really, you can't see in and out. You don't see the chest really rising. How is checking for responsiveness different in an infant as compared with an adult or a child? So with the adult or child, it's the shout, tap, shout. You're going to be tapping them, pushing on the shoulder. With the infant, you're going to be tapping at the bottom of the foot. The adult or child, it's the shoulders. How is opening the airway different in an infant as compared with an adult or child? The infant, you're just going to keep their head in a neutral position, while the child and adult, you're going to tilt it just a little bit further back for the child and then even more back for the adult. How is opening the airway different? Oh, we already did that. Sorry. How is checking for a pulse different in an infant as compared to with an adult or child? So for the adult, you're going to check on the carotid artery nearest you on their neck. The infant, you're going to check the brachial pulse on the inside of the upper arm. So basically like the little part of the bicep between the elbow and the shoulder. On rapid assessment, you find that the person is not breathing but has a pulse. What is the care for this person? So they're not breathing and they have a pulse. So we're not doing CPR. We're just going to be giving ventilations. For an adult, it's 1 breath for every 6 seconds. For a child or infant, it's 1 breath for every 2 to 3 seconds. You're going to do that for 2 minutes, and then you're going to recheck for breathing and a pulse. On rapid assessment, you find that the person is not breathing and does not have a pulse. What is the care for this person? That's going to be getting CPR right away, starting with compressions, and then use an AED as soon as one is available. So once the person comes with an AED machine ready to go, they're going to start putting the pads on. You're going to continue doing compressions and breaths until that AED is turned on and starting to analyze. On a rapid assessment, you find that the person is unresponsive, but they are breathing and have a pulse. What is the care for this person? So they're unresponsive and they are breathing, they have a pulse. You're just going to make sure you maintain that they're breathing. So you're going to put the person in a recovery position if a head, neck, or spine injury is not suspected. And then you're going to perform a secondary assessment as the person's condition allows. Using a resuscitation mask. What are 3 situations when it's necessary to give ventilations? During the rapid assessment when the person is not breathing as a result of drowning, when caring for a person in respiratory arrest or respiratory failure, and when providing CPR to a person in cardiac arrest. What equipment can be used to give ventilations, resuscitation masks, as well as a bag valve mask BVM resuscitator if 2 rescuers are available, or even 3, but you need to have at least 2. What are the key differences when giving ventilations to a child or infant as compared with giving ventilations to an adult? Open the airway slightly past neutral for a child, or neutral position for infant instead of past neutral for an adult. For a child or infant in respiratory arrest, give ventilations at a rate of 1 to every 2 to 3 seconds instead of 1 to every 6 seconds. Also, the amount of breath you give in, the infant's more of a puff. It's just a slight little breath, where the child's a little bit more, and then the adult's going to be even more. You're going to look for that chest to raise. Using a bag valve mask BVM resuscitator. Just with 2 people here, you can see one person is taking care of the bag while the other person is sealing the mask and tilting the head into a neutral or past neutral position. CPR, AED, and obstructed airway care. So for cardiac arrest, it's when the heart stops beating or beats too ineffectively to circulate blood to the brain and other vital organs. Some causes of cardiac arrest could be drowning and other breathing emergency, cardiovascular emergencies such as a heart attack, electrocution, trauma, or toxicity from a drug overdose or poisoning. Signs of a cardiac arrest include sudden collapse, unresponsiveness, no breathing or only gasping, agonal breaths, or no pulse. Providing high-quality CPR. CPR is a technique used to circulate oxygenated blood to vital organs when the heart and normal breathing have stopped. What is ROSC? It's return of spontaneous circulation, or the return of a regular heart rhythm capable of sustaining adequate blood flow through the body. How can we give a person in cardiac arrest the best chance of achieving ROSC? By providing high quality CPR and using the AED machine as soon as possible. For every minute it takes you to get an AED machine up and running, that person's chance of survival decreases by 10%. So you get it up and running, have it with you right away as quickly as possible. What are 5 key principles of high quality CPR? Make sure the person is on a firm, flat surface. Provide compressions at the correct rate and proper depth. Allow the chest to return to its normal position after each compression. Minimize interruptions to chest compressions and avoid excessive ventilations. Single rescuer CPR in an adult or child. What are the key differences when providing single rescuer CPR to a child as compared to with providing single rescuer CPR to an adult? Compress the chest to a depth of about 2 inches for a child instead of at least 2 inches for adult. When giving the ventilations, open the airway to a slightly past neutral position for a child instead of to a past neutral position for an adult. Under what conditions is it acceptable to stop CPR once you start? We'll go over this again the day of, but you're going to see obvious signs of life such as movement, breathing, coughing. An AED is ready to analyze the heart rhythm or ready to shock. Other trained providers take over, relieve you from giving compressor ventilations. You become too exhausted or the situation becomes unsafe. We'll work on CPR together later. What are key differences when providing single rescuer CPR to an infant as compared to providing single rescuer CPR to an adult or child? For the infant, you're going to use the encircling thumbs technique or the 2-finger technique to give compressions. You're going to compress the chest to a depth of about 1.5 inches instead of about 2 inches for a child or at least 2 inches for an adult. And when giving the ventilation, you're going to open the airway to a neutral position instead of slightly past neutral position for a child or past neutral position for an adult. 2-person CPR. It's when one rescuer is responsible for giving ventilations while the other is responsible for performing compressions. When performing 2 rescuer CPR, how often should you switch roles? At least every 2 minutes or when the rescuer giving compression indicates that they are tiring. So when you're getting ready to do that switch, you're going to go switch, 2, 3, 4, continue counting till the compressions are done. The person doing the ventilation will do their 2 ventilations, and then they will switch to compressions. What is a CPR cycle when providing 2 respiratory CPR to an adult? 30 compressions to 2 breaths. When it's 2-person CPR on an adult or a child, does anybody know what that difference is for compressions of the breaths? 15. It's half. 15 to 2. Okay. What technique should be used to give compressions to an infant when performing 2-person CPR? It's the encircling thumb technique. That's when your fingers interlock behind their back and your thumb just goes across their chest, right where the heart would be. If you are the second rescuer to arrive on the scene, the rescuer has completed the rapid assessment and is giving chest compressions. What is your best next action? You need to make sure the EMS has been called, right? Once you find out the EMS has or has not been called, then you help from there. When using an AED, it's a device that analyzes the heart rhythm and advises the rescuer to deliver a shock if an abnormal shockable heart rhythm is detected. If you are the first rescuer on the scene and you have completed the rapid assessment and instructed another member to call EMS, get an AED, and you are now providing single rescuer CPR, when the second rescuer arrives with the AED, what should you do? You're going to continue CPR until the AED is turned on, the AED pads are applied, and the AED is ready to analyze the heart rhythm. Is it safe to use an AED around water? Absolutely. That's what we're going to be using most if we have to. Is it safe to use an AED on a person who is pregnant? Absolutely, because if not, that baby is gone. Is it safe to use an AED on an infant or child? Yes. And keep in mind, if you only have an adult AED machine, use it on a child. If you do not use it, that child's got 0 extra chances to make it through this. So use it on a child or infant, whatever you have, you use it. What criteria should you use to decide whether to use pediatric AED pads or the pediatric AED setting on a person in cardiac arrest? The pediatric pads or the pediatric setting, if available for a person in cardiac arrest who is younger than 8 years old or weighs less than 55. So some do have different size pads. Some AED machines have a key that you could change to. If pediatric pads or pediatric setting is not available, can you use the adult AED and the adult setting on a person younger than 8 years old, weighing less than 55 pounds? Yes, it is safe to use adult AED pads and the adult setting for the child or infant. When using an AED on an adult, how should the AED pads be placed? One pad on the upper right side of the chest, while the other is on the lower left side of the chest, a few inches below the armpit. When using an AED on a child or an infant, how should the AED pads be placed? Same place for a child, upper right, lower left. If the pads might touch, you're going to go one in the middle of the chest and then one in the middle of the back. For the infant, it's always on the middle of the front and the middle of the back. Obstructed airway for adult or child. So a person comes up, they gives a universal sign of choking. You're going to ask, hey, I'm trained in first aid. Can I help? You'll then get behind them, give 5 back blows and 5 abdominal thrusts until they either A, become unconscious, or B, spit the object up. How does obstructed airway care for a responsive child differ from obstructive airway for a responsive adult? You may need to kneel behind a child when giving back blows or abdominal thrusts if you are very tall and they are very short. List 4 situations when it's appropriate to use chest thrusts to clear the airway of an adult adult or child who is choking. So you can't reach far enough around the person to perform abdominal thrust. So maybe they're a little bit big, or they're pregnant, you go on the upper chest. A person is in a wheelchair with features that make abdominal thrust too difficult to use, and back blows and abdominal thrusts are not effective in dislodging the object. So if those aren't working, try the chest. Obstructed airway on an infant. Again, 5 back blows and 5 chest thrusts. But with the infant, you're going to hold their chin or hold their head as you go back and forth on your thigh. If an infant who is choking become unresponsive, what should you do? First, you're going to lower them to a firm, flat surface. Immediately begin CPR, starting with compressions. Um, After every set of compressions and before attempting ventilations, open the infant's mouth, look for an object, and if an object is seen, remove it using a pinky finger, not just a finger sweep, but on the infant pinky, and then provide 2 ventilations and resume compressions if the ventilations do not go in. The ventilations do go in, recheck for breathing and a pulse at that point. Multiple rescuer team response. Additional rescuers join the team response to perform various roles as needed. The compressor gives chest compressions. The ventilator delivers ventilations using BVM resuscitator, while the third person, the airway manager, places and seals the mask and maintains the open airway. The AED operator operates the AED. A multiple rescuer team response contributes to high quality CPR and may improve outcomes. Wet rescuers switch roles every 2 minutes or after 5 cycles of 30 compressions and tube ventilations. To be most effective, a coordinated team response is needed. Critical thinking, decision making, and communication are essential. Every team member needs to recognize what to do and be able to perform whatever role is needed. And then team members must be able to anticipate their own next actions in addition to anticipating the actions of other team members. First aid. When do you do a secondary assessment? When a person becomes suddenly ill or is injured, if the rapid assessment does not reveal any immediately life-threatening conditions. So if you find out that it doesn't look like anything is threatening, then it's, okay, what did you eat? What did you drink? How did you get hurt? Whatever, all those informations. What is the purpose of the secondary assessment? It's to obtain additional information about injuries or conditions that may require care and could become life-threatening if they are not addressed. What information should you ask the person about when you are obtaining a focus history? Use a sample mnemonic to guide your questions. Sample is signs and symptoms. A are allergies. M, medications. P, past medical history. L, their last oral intake. And then E, events leading up to the incident. How do you conduct a focus exam? Check the part of the body that the person says hurts, is holding, or where you see obvious signs of injury. Look and gently feel for signs of injury. Check the person's ability to move the body part unless they are unable or unwilling to move it. And then notice how the person's skin looks and feels and take note of any medical identification tags. A person who's having a seizure in the water, what should you do? You're going to activate the EAP. You're going to enter the water and support that person with their head above water until the seizure ends. I always feel if they're in the shallow end, just hold them there. If they're in a deeper end, you're going to more likely be better to get them extricated, get them out of that water. What is the most important first aid action you should take if you think a person is having a heart attack? You're going to activate the EMS system. And that's starting with somebody calling 911 and getting an AED machine. Decision making in first aid emergencies. We'll do that later. External bleeding. And we'll do that day. Head, neck, or spinal injuries. Watch the video. So the RID factor, recognition, the lifeguard fails to realize that a person is in distress or drowning. Intrusion, the lifeguard is attending to a secondary responsibility while also conducting surveillance. So these are all things that could hinder what's going on. Distraction, the lifeguard is distracted by something or someone that takes away their attention from their surveillance. When you are conducting surveillance, how can you minimize the RID factor? Know what behaviors of distressed swimmers and people who are drowning look like. Watch videos and take part on in-service training sessions with simulations. Never allow secondary responsibilities to interfere with patron surveillance. Make sure another lifeguard has taken over surveillance duty while you're from your zone before you begin working on other assigned tasks, and then minimize internal and external distractions as much as possible. So head, neck, or spinal injuries. Water polo player gets hit in the head with a ball. After the hit, the player appears dazed and seems confused. The game is stopped and the player is able to exit the pool with assistance. What injury should a lifeguard consider in this situation? For sure, concussion. What first aid care should be given to this water polo player? You're going to activate the EAP, instruct someone to call EMS and get the equipment that's needed. Have the person rest without moving and care for any other injuries that may be present according to your level of training. If EMS is not called, advise the person to follow up with a healthcare provider as soon as possible for a full evaluation. If the player starts to feel better, should they be allowed to return to the game? No, not with a concussion. When a person is injured in the water, when should you suspect a head, neck, or spinal injury? If you witness an activity that was high impact or high risk, and if the person has signs or symptoms of a head, neck, or spine injury. They maybe have their head in a tilted manner and just complaining of some neck pain. When should you use inline stabilization and spinal motion restriction techniques to rescue and remove a person from the water when you suspect a head, neck, or spinal injury, but the person appears to be breathing? So you're backboarding at that point. A lap swimmer suddenly submerges and is rescued from the pool bottom. At the surface, they do not appear to be breathing. Would you do a rapid extrication or an extrication with spinal motion restriction? What do you think? The rapid one or head, neck, or spinal injury with a backboarding? Which would you do? Take a guess. There's two answers.
I'd say probably the rapid one because it doesn't seem like they had any like violent motion on their head, neck, or spine that would have caused a need for the spinal motion restriction. And if they're
And,
not
and the
breathing underwater,
Right. That's the biggest one. If they're not breathing, you got to get them out. Even if you suspect a head, neck, or spinal injury, that doesn't matter because if they're not breathing and you take 3 minutes to do all the backboarding stuff, you've lost 3 minutes of stuff that you can do on them. So get them out right away. So rapid extrication, there's no reason to suspect a head, neck, or spinal injury, and the person does not appear to be breathing. So the main priority is removing them from the water immediately and begin resuscitation care. Patron dives off the diving board, strikes another patron in the water, and goes limp. When turned face up, they appear to be breathing. Would you use a rapid extrication or an extrication with spinal motion restriction? Assuming you're all going to know, it's going to be the second one on this one. The mechanism of injury was high risk, high impact, so a head, neck, or spinal injury is possible. Because the person appears to be breathing, the priority is minimizing the movement of the head, neck, and spine while rescuing and removing them from the water. We're not going to worry about a wakeboarder. We don't do that. What are examples of life-threatening conditions that would possibly take priority over a possible head, neck, or spinal injury? So respiratory failure, respiratory arrest, a cardiac arrest, or life-threatening bleeding. That's it for that, but I do want to show you one last thing. And so this is a video. Some of you have seen it before, some of you have not. It's a video about Yoni Gottesman. This is, as you see, the video is very old, but it's just important to kind of see what happened. We won't watch the whole thing, but we will go through it briefly. Over here in the middle of the right is a lifeguard. Keep in mind where this looks like an area right here, that is a lifeguard watching everything that's going on. Looks as if there's only 8 or 9 kids in the pool. Keep in mind, this is first day of camp. The red circle is Yoni. From his position, that lifeguard was probably about 5 to 10 feet from where Yoni is. fast forward a little bit here because as you can see, the red circle is Yoni. He is not moving. If you go to almost 6 minutes later, Yoni is still not moving. There's kids around him, but nobody has seen him. Multiple parents, multiple people walk around. Here's another couple minutes later. Eight minutes, and he was probably within 10 feet of that lifeguard the entire time. Why your job as lifeguards is so important. You always need to be paying attention what's in the pool. And Yoni passed away, unfortunately. His parents actually put that video on the web. They wanted everybody to see it, and that was part of their lawsuit. So again, this is why your job is so important. I appreciate everybody's time today. I'll get you the information, the online stuff as soon as possible. Enjoy the rest of your Saturday. Thank you all very much for being here. I appreciate it. Bye.
Thanks, Mark.
Thank you so
Thank
much.
you all.
Hey, Mark.
Thank you, Sean.
Yeah.
All right.
Mark, goodbye.